Hey guys, VideoJames, and this is a game called Amateur Surgeon Arm Surgery. This is basically, you're given a patient who has something that requires surgery, and you are the doctor who has to do the surgery. So, I've seen some other people play games like this, but I don't think they're the same, because they don't look like they're made by the same people. But let's go ahead and get in. Quick, we have a patient in the ER. I've looked her over, and all her vital signs are normal. She does have a bump on her arm, so I'm going to take her and give her an x-ray. Right here, we'll be back. Oh no, I tripped on my way back and all these patient files got mixed up. Okay. You're a nurse. You're not supposed to be clumsy. Pick out the right x-ray so we can treat the patient. Well, I'm guessing since it's an arm surgery, it'd be this thing. How should we treat her, Doc? Maybe this menu... Well, if it's the surgery simulator, then probably that one. The right size fixation plate, is it this? I'm not even sure what a fixation plate is. Use that one. The sleeve has got to go before we operate. Not only can it make it difficult to see, but we could get an infection from it. Got it, getting it done. Cut off the sleeves. You don't have no tricks up your sleeves anymore. Use the tourniquet. What does big word mean? Okay, we're doing good. We're doing grand. No one's dying yet. Time to sterilize the area. Get these tongs to get a cotton ball and dip it into this. Then all over the arm. Oh, the patient's vital signs have suddenly dropped. Keep an eye on her heart rate. We can't let it drop below 14 beats per minute. We need to hurry this operation. If we aren't done in 5 minutes, we might lose her. Well, that's not good. Alright, I need the scalpel. I need the scalpel to make the incision. Oh, this doesn't look good. Oh, God. A few veins have started to bleed, but it's nothing to worry about. Just use the Bovie to cauterize them. Is this thing. Ow, 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 ow. Click on the bleeding veins to cauterize them. Oh, I have to click? There's not much room to work. Use the clamps to open the incision a little more. Got it. Open says, yeah. Why did it make like a... No, it made like one of those sounds where you're using that thing. That bluish tube is her nerve. Be careful not to damage it, as the patient could lose all feeling in her arm and hand. Grab some sterile string so we can safely move it. String. Now use the string to pull the nerve. Okay, I'm doing this thing. Look at all those bone fragments. Let's remove them right away before they can puncture anything vital. Grab the tongs. I'm gonna do this thing. I'm gonna take you. Get you out of here. Get number 2. And get you. That it. Yes, I did it. Set the bone back. The best way to do this is pull the hand a bit so the surrounding tissues push it back into place. Now move her hand gently. Oh god, this is weird. Perfect. Really? Put the fixation plate and put it into position. Put it on the bone. In order to work properly, it needs to be screwed into the bone. Oh, that's always one of the worst things. It's like, you imagine you have to get stuff screwed into your bones. Oh, and that's the exact sound I thought. Ugh. God, you always fear when you break a bone or something like that you're gonna have to get stuff drilled into it, and that is like the worst thing ever. Okay, get drilled in the bone. Now screws in the spots. God, we're turning her into a freaking bionics. Oh, I have to tap the screw. Well, I don't know these things. I are not a surgeon. I are only an amateur. It's my first day on the job. Now insert them. I'm guessing screwdriver. Screw in. You are going to be Autobot by the time we're done. Go in, would ya? There we go. Really? You have to be that finicky that you can't line up right? I've seen this procedure formed. Great, now time to close up the wound, pick the needle, and stitch the wound. Okay. I'ma do this. I've been playing a lot of Dumb Ways to Die lately, so I'm sure I can do this. I did it! Rate amateur surgeon, no. What did I get? I didn't say rate. Go away. Ask me later. Mistakes, minus 100 points. Time, 11,700 points. Score, 11,600 points. That's actually pretty good. That doesn't seem that bad. Oh, she's all happy. Look at her. You're welcome, little Cindy. Okay, did I click button? Hello? Okay, well, that was Amateur Surgeon Arm Simulator. I don't think this is the same thing I've seen other people play, because I've seen this game before. I've seen, like, the same characters in this game, in other games. But I'm not so sure if this is the same game, because it doesn't look the same. But anyway, that was Amateur Surgeon Arm Simulator. I'll see if I actually do have the right game, and if not, I'll leave a link to the actual game down in the description, because I don't think this is actually it. But anyway, hopefully you guys liked this video. If you did, go ahead and slap that like button as always, and I will see you guys later. Oh, I said slap. That might have been insensitive to little Cindy. Don't slap. Just kick it.